Hi Biology, Mr. Wegner here. Today we're going through our slides on STDs, sexually transmitted diseases. Go ahead and take your note packet out. If you don't have one, you can print it out from the folder here. But you should have picked it up hopefully at school for packet pickup. If not, there are still copies available at school. You can still go there and pick up copies or write it down into a notebook. Let's talk a little bit about sexually transmitted diseases. An STD transmission, that's how it goes from one person to another, has to be person-to-person transfer of bodily fluids, such as semen, saliva, fluid to an open wound, vaginal secretions, or blood. Most often it's transmitted through sexual contact, even oral and anal sex. It can also be passed on during childbirth or sharing needles. The thing with these diseases is they need to be kept warm, body temperature, so it literally has to go from a warm body fluid to another warm body fluid to get transferred. That's generally the case, not 100%, but for the most part, that's how it works. STD transmissions. Most STDs are highly contagious. Highly contagious means you can get it very, very easily. Very easy to pass on from one person to another. As an example, one sexual encounter with an infected male, a female has an 80 to 90% chance of getting gonorrhea. More than one disease can be passed on at a time. Many STDs are not curable, only treatable. What does that mean? It means that there is no cure. They can simply give you medicine to lessen the effects, but some STDs, once you get them, you have them for the rest of your life. So again, one encounter is all it takes, and a woman is 80 to 90% chance of catching something like gonorrhea if the man has it. If you are cured of one STD, you are not immune to it. Some have symptoms, but not all, and not all the time. Some symptoms are more visible in males. Most females don't have visible signs early on and could easily infect someone else unknowingly. Many females are not diagnosed at all, or they're wrongly diagnosed. And of course, the reason that the symptoms are more visible in males because the male sexual organ is on the outside of the body. It's outside, it's there. The female sexual parts are all on the inside of the body, so it's very difficult to locate and see outward signs as easily. Here's some facts. STDs are common among young people. About 333 million new cases of curable STDs occur each year among young adults worldwide. 1 in 5 people in the United States has an STD. 1 in 5. 1 in 4 new STD infections occur in teenagers. 1 in 4 people will have an STD at some point in their life. 1 in 10 teenagers know someone who is HIV positive. 56% of teenagers aged 12 to 17 years of age think STDs are a big problem for people their age. In Wisconsin, in year 2014, that's when these stats were taken, between 15 and 19-year-olds, females contracted 78% of bacterial STDs. Ethnicity is not a factor. It doesn't matter if you're white, black, Latino, Hispanic, whatever. 7,564 bacterial STDs are diagnosed in this age range. So 2 different kinds. Looks like we got we're mainly talking about bacterial STDs here, not viral. In Wisconsin, in this age range, 15 to 19, since 2011, so that's over 3 years, chlamydia has been decreasing, gonorrhea has been decreasing, and syphilis has been decreasing, although there was a spike in 2013. Types of STDs, there are 2 kinds. First one is called bacterial, caused by bacteria, and viral STDs are caused by viruses. Bacterial and viral STDs vary in their treatments. Bacterial STDs, such as gonorrhea, syphilis, and chlamydia, can be cured, completely gone, with antibiotics. However, if you get viral STDs, such as HIV, HPV, which causes genital warts, herpes, and hepatitis B, sometimes these are known as the 4 H's, they have no cure. But their symptoms can be reduced with treatment. Vaccines do exist for hepatitis B and HPV. So in other words, once you get one of these viruses, you will have it for the rest of your life, unless they come up with some cure down the road. But otherwise, once you've got it, you've got it. Some STDs have symptoms, but not all, and not all the time. It's important to remember that some STDs cause no symptoms, and when symptoms do occur, they're often not recognized. Most people with STDs have no symptoms. Most people, that's the majority, have absolutely no symptoms, none. So a person can be infected and infect someone else without even knowing it. However, there are some common signs to watch for. So very often they'll say, well, we looked and it didn't look like anything was wrong with this person, so they must be okay. Again, the majority of people do not have any symptoms. You can have this disease and have no redness, no scars, no blisters, no pains, no nothing, and still have the disease. Looks don't mean anything. Symptoms can show up anywhere from 2 days to a couple of months after initial exposure to the disease. Some symptoms can show up as long as several years after the initial STD infection. Specific symptoms might include, they don't always have to, but they might include bumps or blisters near the mouth or genitals, burning or pain during urination or a bowel movement, flu-like symptoms including fever, chills, and aches, as well as swelling in the groin area. STDs are preventable. Preventable means you can do things to make sure you never catch one. People can get STDs when they engage in vaginal, anal, or oral sex. The only sure way to prevent getting an STD is to not have sex. If you have sex with someone who has an STD, you can and probably will get it also. Condoms can dramatically reduce your risk of contracting STDs when used consistently and correctly, but they don't prove 100% protection. They do not offer 100% protection. Let's talk about the different types of STDs that we have. First one is called chlamydia. One of the most common reported STDs. 92 million new infections each year. Affects more women than men. Caused by the bacteria Chlamydia trachomatis. Infects the cervix, urethra, and rectum. Usually it lacks symptoms, so most of the time this has no symptoms. But if there are symptoms, they usually don't show up until weeks after the infection. 70 to 75% of women with the disease are asymptomatic. That means no symptoms. Asymptomatic means no symptoms. If symptoms are present, they could be a discharge, pain in urinating, irregular menstrual bleeding, or swelling in testicles. Can be passed on through vaginal, anal, or oral sex, and during vaginal birth it can be passed on from the mother to the infant, from fingers to eyes. So the child rubs the fingers along the vaginal pathway as it comes out, rubs the eyes, and now it's infected with the disease also. Treatment involves antibiotics, and they can be 95% effective. But often there can be complications in women. In women, you can get PID, pelvic inflammatory disease, which can lead to ectopic pregnancies. Those are pregnancies that occur outside of the womb, miscarriages, or infertility. It can also lead to cervicitis. Can lead to pelvic pain and backache. Men, it's less common than female with the complications, but it can lead to epididymitis, can lead to an infertility, urethritis, an infection of the urethra, can affect ability to urinate and kidney function, and reactive arthritis. If it is passed on to a baby during pregnancy, it can lead to eye or lung infections. Next one is called genital herpes. Genital herpes is caused by an infection with the herpes simplex virus, HSV. There are two types of HSV in larger groups that also include the chickenpox. So chickenpox is in the same group as herpes simplex virus. There's HSV1. You get this through mouth contact. It causes cold sores. If you've ever had a cold sore, you've had HSV1. That is not the sexually transmitted kind. Sexually transmitted kind is HSV2, and that's what's acquired through sexual contact. HSV2. Only around 10 to 25% of people infected with HSV2 are aware they have genital herpes. So if 10 people have it, only 1 or 2 know they actually do have it. Many times it's asymptomatic. Again, that word means no symptoms. If symptoms do occur, they'll usually appear 2 to 7 days after exposure, and they'll last for 2 to 4 weeks. Both men and women may have 1 or more symptoms, including itching or tingling sensation in the genital or anal area, small fluid-filled blisters that burst, small painful sores, pain when passing urine, especially in women, headaches, backaches, flu-like symptoms, including swollen glands or fever. Future outbreaks of herpes are usually milder and last for a shorter period of time, usually 3 to 5 days. Genital herpes is passed on through skin contact with a person infected possibly through vaginal sex, anal sex, oral sex. The oral sex, you can get HSV1 or HSV2, or kissing. Kissing, you can only transmit HSV1 only. There's no cure, and treatment isn't essential since the symptoms usually clear up on their own. Once the initial outbreaks of herpes is over, the virus hides away in the nerve fibers adjacent to the infection site. Some people never have a recurrence. Others can have recurrences 6 times a year. That's every 2 months. Complications. HIV and genital herpes likely to have more frequent and severe recurring episodes of genital herpes. It increases the risk of becoming infected with HIV by up to 3 times in both men and women. Pregnancy and genital herpes. If herpes is transmitted in the first 3 months of pregnancy, there's a small risk of miscarriage. The first episode of herpes during pregnancies carries a greater risk of transmission to the baby. Becoming infected toward the end of pregnancy may cause the baby to be born early. If it's left untreated, the infection can cause damage to a newborn's internal organs, skin, and central nervous system, and may even prove, for the baby, fatal. Genital warts, HPV. Genital warts are caused by HPV. There are over 100 different kinds of HPV. HPV infections don't always lead to genital warts. HPV, by the way, stands for human papilloma virus. Warts form 1 to 3 months after the infection. If symptoms do appear, then the infected person may notice pinkish white small lumps or large cauliflower-shaped lumps on the genital area. Genital HPV is transmitted by genital skin-to-skin contact or through the transfer of infected genital fluids. This is usually during vaginal or anal sex, but it's also possible to pass it on through non-penetrative sexual activity. So if you're just rubbing up against each other, it's still possible to pass on genital warts from one person to another, even if there's no penetration. In rare circumstances, a woman can pass HPV onto her baby during vaginal childbirth. There's no treatment that can completely eliminate genital warts once a person has been infected. Warts are caused by a virus, not a bacterium, so antibiotics will not get rid of them. Complications. Some types of the human papilloma virus, HPV, notably types 16 and 18, have been linked to changes in cervical cells, and that can lead to cancer. So if you have HPV 16 or 18, it's very likely it can lead to cancer. Let's talk a little bit about gonorrhea. Gonorrhea is caused by the bacterium Neisseria gonorrhoeae. It affects both men and women and can infect the cervix, urethra, rectum, anus, and throat. Gonorrhea is one of the most common STDs. An estimated 62 million cases of gonorrhea occur each year, affecting, again, more women than men. Gonorrhea is easily curable, but if left untreated, it can cause serious health problems, such as pelvic inflammatory disease, PID, which can lead to abdominal pain and ectopic pregnancies in women. Untreated gonorrhea can also lead to infertility, meningitis, that's an inflammation of the tissue around the brain, and septicemia, that's infection of the blood. Gonorrhea symptoms may appear 1 to 14 days after exposure, although it is possible to be infected with gonorrhea and have absolutely no symptoms. If you do have symptoms, though, they might include a change in discharge, a burning sensation or pain while passing urine, irritation in or discharge from the anus. How is gonorrhea passed on? Through penetrative sex, including vaginal sex, anal sex, and oral sex. Complications in women can lead to pelvic inflammatory disease, PID, increases the future risk of ectopic pregnancies. Again, that's a pregnancy that occurs outside of the womb, or premature birth. A pregnant woman can pass the infection on when giving birth. The baby could be born with an eye infection, which can cause blindness. For men, inflammation of the testicles, and prostate gland, potentially leading to epididymitis, and can cause infertility. Infertility means you're not able to have kids anymore. A narrowing of the urethra or abscesses can develop. This can cause considerable pain and problems while urinating. Let's talk about another one, syphilis. Syphilis is an STD caused by the bacterium Treponema pallidum. Syphilis has been uncommon since penicillin became widely available in the 1950s, although in recent years the number of cases has been rising. Syphilis symptoms comes in stages. The primary stage, also called the first stage. One or more painless ulcers appears in the place where the syphilis bacteria entered the body after about 3 weeks and takes 2 to 6 weeks to heal. If the infection is not treated at this point, it will then progress to secondary stage. Secondary stage will usually occur from 3 to 6 weeks after the appearance of the cancers. Symptoms often include a flu-like illness, a feeling of tiredness, loss of appetite, accompanied by swollen glands, an itchy rash, flat, warty-looking growths on the vulva in women and around the anus in both sexes, white patches on the tongue or the roof of the mouth, patchy hair loss, very infectious. Treatment during the first 2 stages of syphilis will cure the infection. There's also a latent or tertiary stage. If treatment was not received during the first 2 stages, then it will progress on to the latent stage. If left untreated, the infection may develop into a symptomatic late syphilis, also known as the tertiary stage. This usually develops after more than 10 years and is often very serious. At this stage, syphilis can affect the heart and possibly the nervous system. If treatment for syphilis is given during the latent stage, then the infection can be cured. However, any heart or nervous system damage that occurs before the start of treatment may be irreversible. So the damage that's caused cannot be undone if it's done to the heart and the nervous system before you start treatment. How syphilis is passed on can be transmitted through direct contact with a syphilis sore. The methods of transmission are by having vaginal, anal, or oral sex with someone who has the infection, from a mother to her unborn baby. Syphilis cannot be passed on by sharing baths, toilets, towels, or eating utensils. It's a common myth. Syphilis. Let's go back to syphilis. Just one more note on that. The very famous gangster Al Capone died of syphilis. He got syphilis, was not treated, probably didn't realize he even had it. And by the time it got later on in stages, it led to heart disease and nervous damage and caused his death. So the gangster Al Capone died from a venereal disease, a sexually transmitted disease called syphilis. HIV stands for Human Immunodeficiency Virus. HIV destroys certain white blood cells. When HIV weakens the immune system, a person is more susceptible for developing a variety of cancers and becoming infected with viruses, bacteria, and parasites. HIV is the virus that causes AIDS. There is no known cure for HIV or AIDS. How HIV is and isn't transmitted. A person can become infected with HIV in these ways: having sexual intercourse, vaginal, anal, or oral, with an infected person, sharing needles or syringes with an infected person. Women infected with HIV can pass the virus on to their babies during pregnancy or during birth. They can also pass it on when breastfeeding. A person cannot become infected with HIV in these ways: through everyday contact with infected people at work, school, home, or anywhere else, by using the toilet, shaking hands, sharing utensils, phones, or clothing. One cannot be infected with sweat, tears, sneezes, coughs, or urine. HIV cannot be carried by mosquitoes. In Wisconsin, 2011 cases, 68% of all HIV cases were male, 32% were female. 38% white, 40% black, 16% Hispanic. 5% were the ages 15 to 19. 19% were the ages 20 to 24. 15% were 25 to 29. And 35% for all cases are 35% of all the cases were found in Milwaukee. 35% of all cases of HIV were found in Milwaukee. Last one, I believe, lice, pubic lice, also called crabs. It's not caused by sexual contact. It's technically not an STD, not a virus or a bacteria. It's actually tiny little insects living in the genital area. It gets spread through sexual contact, as well as when bed sheets, clothing, or towels are shared. Can create a rash. Can be treated with medicated shampoo. And that's pretty much it. So basically lice, very similar to head lice, but this is lice that specifically lives down in the pubic area. And when sexual contact occurs, it passes on from pubic area of one person to the pubic area of another. So again, here is our sexually transmitted diseases list. Go ahead and fill out your notes as best you can, and we'll talk a little bit more about sex. We'll talk a little bit more about God's plan for sex as we get ready for a test. It looks like maybe sometime next week or the week after. All right, take care. God bless. Have a really great day.